Hi and welcome to these osteoporosis and prolapse exercises for hips. My name is Michelle and I'm a pelvic floor physiotherapist with a special interest in safe exercise. So this means prolapse-safe exercise and pelvic floor safe exercise. The exercises we're doing today are to strengthen your hips. So we're doing these exercises lying down. I'm going to guide you through the workout step by step. We'll start the exercises unweighted. I suggest you start exercises unweighted at home when you're just getting the right form, and then you can progress to using the weights as I show you as you feel comfortable, remembering that all the exercises should feel really comfortable and always cease any exercises that cause you any discomfort. So let's get started now. We're going to start lying down on the ground. If you feel comfortable doing these on a bed, a firm bed, you can do these exercises on a very firm bed as well. You might like to use a cushion to support your head or a pillow to support your head throughout the exercises as well. I'll meet you on the mat. Now, our first exercise is a bridging exercise. This is one of my favourite exercises for strengthening the hips for prolapse problems as well and keeping the exercises pelvic floor safe. So this exercise strengthens the large buttock muscles, the gluteus maximus muscles. What you do is you start lying down on the mat. So you're going to start lying down flat. You can use a pillow underneath your head. If you've got curved spine, you can possibly use a couple of pillows. Ideally, you take your knees slightly apart. So my knees are just slightly wider than hip width apart here, and my feet are flat down. You can see that my toes are turning outwards. So they're not forward, they're actually slightly turning outwards, and that's to get maximal activation of my buttock muscles. Now, when you're doing this exercise, bring your arms down by your side. No pressure on your neck. What you do is you bring your heels in fairly close and you press down through the heels and lift your bottom off the ground like this, using the buttock muscles, and then coming back down slowly and relaxing. Now, when you first start out with this exercise, it obviously should be pain-free, but just go through the range that feels comfortable for you. So that might be as far as you can lift first of all. That's absolutely fine. Lift up and come back down. Let's go again. Press down through the heels, lift up, bottom off the ground. And then if you can lift progressively higher, that is fantastic too. And come back down. Now, ideally with your exercises, you're trying to do up to 8 to 12 exercises in a row if you can. You might need to build up for that if you're a beginner, but just doing what feels comfortable for you, breathing out as you lift, keep it safe for your pelvic floor, and slowly back down. Now, this is a great pelvic floor safe position to do these exercises because the pelvic floor isn't under any load, which is wonderful. So, and we can really get some really good strength gains into our buttocks and into our hip bones and down. Now, we're just about, I think, at one set. I haven't been counting. I've been too busy talking with you. We're trying not to tighten the hamstrings. We're trying to tighten the buttocks as we lift, and then lower down slowly. Remember, you make most of your strength gains when you lower down, so lower down slowly. Now, if you'd like to progress this exercise, you have a number of options. You can use 2 weights, and I've got 2 dumbbell weights here. You could start with a couple of pounds, that would be fine. What have I got here? I've actually got 2 kilos, a couple of pounds. Bring your heels in nice and close. I've got one weight on each hip. And so what you do then is you breathe out and lift up, again pushing through the heels, lift up, and slowly back down. And you can see that I do like to keep the inward curve in my back. Some people tend to flatten their backs out. I tend not to want to exercise like that with prolapse and pelvic floor conditions. I prefer to keep the inward curve in the back. So drive down through the heels, keep the inward curve, and then lower back down slowly. So you don't need fancy weights. You could use a couple of tins from the cupboard, a couple of cans. Just start with what feels comfortable, breathing out, lifting, and lowering back down. Now, the other alternative is you can use one heavier weight, and I'll just show you this now as well. This is a 5 kilogram weight, so it's a little bit heavier. And what you can do then again is press down, lift up. And again, this is a wonderful exercise because you can really load it up, strengthen your bottom, strengthen your back, your low back and your hips at the same time, and not affect your pelvic floor, which is really wonderful. I'll do a couple more reps here, lifting up. Just take it slowly and down. And one more time, remember to push down through your heels, breathe out, use your bottom muscles, and then slowly lower back down
and rest. Now you can do 2 to 3 sets of these a day, which would be fine. I'm just going to do 2 sets for the demonstration. All right, the next exercise we're going to do is also for our hips, another one of my favourites. This is called a clam exercise. Now it's a little bit different to what you might have already seen the clam done before. The clam exercise is a wonderful exercise for the muscles in here. They're the muscles at the sides of the hip. And this is an excellent exercise for hip bone density because it's an unusual movement that we're going to do, but also to very pelvic floor safe so you can load it up. Now, we'll start with the correct position and technique first of all. What you do is you keep your knees stacked. So I'm looking down here, I can see one knee above the other knee, not one or behind the other. And I can look down and see my heels behind my bottom in line with my back. In this position, what you do is you just lift your knee, top knee, just away from the bottom knee. Now, the tendency used to be to do clams like this, and this is a rotation for the back. We're not doing that. We're actually going to keep the control of the trunk and just use the hip. And you can see I do this by keeping one knee just stacked above the other knee. And can you see how small the lift is there? Taking it down. So I'm going about, what size would that be? I guess that's like a tennis ball size, if you can imagine a tennis ball, or a little bit less, and down. And you'll find the range that you can comfortably move without rotating your back. So really think about, with this exercise, lifting up, keeping the trunk stable, and lowering it down slowly. Again, that lowering down slowly phase is very important for strengthening through this area, and down. And let's do 2 more here in this position. You can see I've got my hand under my head here supporting my neck, so my neck isn't on an angle. You could be using a cushion at home just to support your head and neck, lifting up and then slowly lowering down. How did you go with that? You can probably start to feel the underside hip working as well. One of the wonderful things about the clam exercise is it uses the top hip muscles as well as the bottom hip muscles as well. So you're actually getting a double benefit. Now, the way you can load this again very safely with prolapse problems is bringing a weight onto the thigh. Now, if you put the weight up here, it's as good as useless. It's not going to do anything for loading the hip. The way you need to do that is to put the weight down as close to the knee as you can. So I try and roll the weight really close to the knee. Again, I've got that couple of pounds here, well, maybe 2 or 3 pounds, 2 kilos, and I'm just lifting up slowly. And you can see that range of movement, and then I'm lowering down slowly as well. Again, there should be no pressure on the pelvic floor with this exercise. Again, so it's very prolapse safe and pelvic floor safe, but you are doing wonderful things because it's an unusual movement for your hips, so great for hip strengthening. And I can feel my hips working there already. I hope you can at home too. This is number 4. And again, I just like to breathe out routinely with a lift and then breathe in. It's just a habit I have because when you breathe out with the effort, it takes pressure off the pelvic floor. So we'll do just a couple more here. Let's do the last 3, lifting and lowering. And you can see it's a slow pace. It's not fast. You want the muscles to work, so you want to do these exercises slowly, lifting for 2 and down for 2. And we'll do one more time, lifting for 2 and down for 2, and then have a rest. And so then what you would do is do the same exercise on the other side so that you're even, not unbalanced. So that's our clam exercise. So far we've done the bridge and the clam. The third exercise I'd like to show you is it's a leg extension, and what we're going to do with this is a little bit unique in that we're actually going to angle the leg so that we're actually activating the muscles that attach to the hip more so than what they would otherwise. So taking your leg out straight, and I hope you can see my toe pointing downwards in the footage there, but my toe is pointing down. So I'm not going to lift with my toe pointing towards the ceiling. I'm actually going to lift that leg just to there, not too high, and then slowly down just so the toe touches. So I'm leading with the outside of my ankle just to that height and down. You can see it's not a very high lift, is it? This is the area that we're working in here, and if you put your hand here, you'll feel your glute. These are the smaller glutes, not your big glute max. These are the lateral glutes that are working. And these are great for your hip bone density. So lifting up, and the weight of your leg is often enough to start you off there. You can see I've got the lower leg bent just for stability. Again, my head is supported. Lifting up and lowering down slowly. And one more time at home, lifting up and lowering down slowly. And you can bring your knee up and have a rest. Now, you could be alternating sides if you wanted to during your workout. I'm just showing you on one side just for the purposes of the demonstration.
Now, to load this exercise, very similar to the last exercise, you take your weight and once again, leg down, toe pointed down, but roll the weight as far down as you can down your thigh. Now you could obviously use a strap-on weight around the thigh, even closer to the ankle if you wanted to do that. It would be very effective for you strengthening and much easier on the hands rather than having to hold it as I'm holding the dumbbell here. So a weight that you can readily purchase that just strapped around the ankle or even around the knee if you needed to for starters would be ideal. Now you can see I haven't got that leg forward, I've got that leg back in line with my body. And here we go for our second set, the loaded set. So lifting up just to there and take it down slowly. Go again, just take it steady. Think about the muscles that you're using. So use that brain to muscle connection, thinking about using your lateral hip. Got to concentrate on that particular muscle group. And again, if you're not sure and if you're still starting out, you can put your hand up here and you'll feel that area tensing underneath your hand. I'm trying to be very clever here, balancing that weight on my leg just to demonstrate to you at the same time, lifting and lowering. We'll do 2 more here. Lifting, lifting and lowering. And 1 more time here, lifting and lowering, and take a break, weights down. So again, other side, same thing, lifting and lowering the leg. Now, the fourth and final exercise I'd like to show you today is a really nice exercise using an exercise band. Now, there's a range of exercise bands you can get very inexpensively online. This is a rubber band. This is one of the fabric bands. I tend to favour these more. These are much more comfortable on the legs and also provide a little bit more resistance. But this exercise involves lying on our backs and using the band. Now, what we do is we actually put the band, and I'll show you how to position it. So you bring one leg up at a time, and the band is actually going to be positioned down there. So it's basically in that position there, just above our knees. Now, this is a great technique to use, or a great piece of equipment to use to add some resistance to your hip exercises. So you can do a basic legs apart and back together just a little bit. So again, I'll just come around a little bit so you can see me better there. So I'm taking the legs just apart. You can see the position of my feet. And again, they're turned outwards. I'm keeping the inward curve in my back, taking the legs apart. Now this is using the outer hip muscles, but I want to show you how to progress this. So you can do a set of these, taking the knees apart, and you'll pretty quickly feel these muscles at the sides of the hips working. Again, this is pelvic floor friendly, prolapse friendly. You can use good resistance on this and you won't have any worries with your pelvic floor. Again, and I'm really starting to feel this in my hips already. This section here is where you'll feel this. Non-slip on the inside, so they'll stay in position. And I'll do 1 more of those and back. So that's the starter exercise. Now, you can actually advance this a little bit by doing this. So bring again. So in this position now, you can take the knees apart, put the tension on the band. And what we're going to do is, remembering back to our very first exercise, I've already got these outside muscles on, these muscles that attach in here and around the hips, so it's already lovely for hip strengthening. Now what we're going to do is lift the bottom again and use the back muscles as well. So we're getting basically 2 for the price of 1. We're getting the outside hip muscles working as well as the larger buttocks. Excellent for low back, excellent for hip strengthening and release and down. And I can really feel that. I hope you can feel that at home if you're using a band too. Let's take it apart. Just get the tension on there, lift up, and you don't have to lift right up if it's not comfortable for you yet. Otherwise, you can take it right up in the air into that position, not hyperextending your back, just going to that neutral position, breathing out as you lift, and then lowering down slowly and release. Let's go through right to the end here. So out, breathe out and lift, press through your heels, use your bottom, lower down slowly and release. And again, take it apart. Lift up and come down slowly and release. Let's do 2 more of those at home. Take it apart, lift up, and I can really feel this working my hips. Perhaps I need to be doing a few more of these. Down and release. This is an exercise that I use with my classes much of the time, and ladies really benefit with their hip strength with this particular exercise, taking it down
and release. So there you have it, that's the band exercise. So you've got the option of just doing the knees apart or taking the knees apart, lifting, lowering down and back down to keep it pelvic floor friendly, pelvic floor safe and prolapse safe as well. So the pelvic floor safe way to get the band on and off, which I should have showed you in the first place, is on your side rather than on your back, and actually taking the band off sideways like that and kicking it off sideways rather than doing a sit-up exercise, which we know isn't pelvic floor friendly. So then you might like to just do some buttock stretches, some really gentle buttock stretches and some back relieving exercises. So you can do a very gentle tilt of the low back and roll back through. Again, a very pelvic floor friendly, prolapse safe exercise to do. You might like to bring one knee at a time to the chest, leg down if that feels comfortable. Otherwise, just keep the leg bent. That's no problem at all. And taking it down to the other side, taking the knee up towards your chest just slowly, relaxing your breathing. And taking it down, relaxing down slowly. And then you can finish off with just a few small rotations. Remembering that if you do have osteoporosis, it's really important that you're not doing big rolls and big rotational movements through your back. I'm just keeping these small. Always keep your feet down flat on the mat. Never do rotations with the legs raised. That isn't pelvic floor friendly and it isn't good for the low back either. So just in that position, those little rolls and down. And there we have it. So rolling onto your side to come up safely, pushing down through your elbow and coming up. So I really hope you've enjoyed this little hip exercises, this hip exercise strengthening for osteoporosis and prolapse routine. It's something you can do every day of the week if you like to. Optimally with your bone strength exercises, you're trying to do them at least 3 to 4 times a week with this sort of range of exercise. If you're doing heavier weights, it would be optimally 2 to 3 times. So I really hope you enjoy this routine. If you have, please let me know in the comments below and give the video a like, because then YouTube will share it with other women with osteoporosis and prolapse that can benefit as well. If you'd like more exercise videos, please feel welcome to let me know. Always love making new exercise videos for you. And I look forward to seeing you in the next video, which is some back strengthening exercises. So stay with me for that now. See you in the next video. Goodbye for now.